As I mentioned just a moment ago, earlier I had a chance to speak with Congresswoman Nanette Barragán from California, who serves on the Energy and Commerce Health Subcommittee and whose mother is an Alzheimer's patient. And she is one of the caregivers. She is a principal caregiver on Sunday nights and Monday nights. Powerful story. Listen to it. Here's my conversation with the Congresswoman.
Representative Barragán, thank you so much for joining us. This topic is one that I feel every year I've been probably moderating for 30 years. And, you know, in the United States of America, with all our resources, the advancements in science, this is one where I just feel like the faster we pedal, the further back we've gone. But I would love you to dissuade me from that, because I know this is an issue of Alzheimer's in America that you care very much about.
Well, you know, Alzheimer's is a personal issue for me, and we know that Hispanic and Latinos face 1.5 times greater risk of developing Alzheimer's disease. So when you talk about my constituents, you talk about the American people, this is something that we need to get a grip and handle on in making sure we're providing resources to families and that we're helping these new drugs and, develop and not stand in the way, which is why I'm concerned about the CMS decision that will require clinical trials to be conducted in hospital-based outpatient settings. You know, I think this is going to really limit the demographics of people who are going to have access to these drugs, people of color, low-income communities, people who live in rural areas. So I just hope we can continue to invest.
Well, why don't we unpack that for a moment for our viewers who may not know all the decisions about CMS and how it impacts, you know, a class of drug that they have decided to cover for those people in clinical trials, but not for those who are outside. It sort of divides the territory. How much awareness is there among your colleagues of how divisive this could be?
Well, I've talked to some of my colleagues about it, and certainly some of them who have family members who have Alzheimer's. And I think there is a split. But let me tell you, when I first read about this drug, and I took my own mother in to see her neurologist, the neurologist brought up the drug and talked about it. Unfortunately, my mother was too severe, too far along to get it. And then I later found out that CMS was not going to even allow somebody like my mother to get access to it, right? So CMS made this decision that really, I think, is going to have a negative implication on an entire class of drugs that can have positive impacts on Alzheimer's. Now, there hasn't been a lot of progress on Alzheimer's drugs for a long time. So when you see something promising, for me, I thought it was something to celebrate and something that people are going to have access to. So I think that CMS should not include future promising amyloid Alzheimer's drug within their coverage decision. Now, their decision severely restricts patient access to an entire class of drugs for Alzheimer's. And that means that patients and people who can pay out of pocket will have access, but others will not. And so for me, it's an equity issue as well.
Well, I think, you know, and very happy you laid that out. I think in addition to the preponderance or sort of the unequal prevalence of Alzheimer's in, you know, across different groups in society, but nonetheless, baby boomers are retiring. We're going to see more and more Alzheimer's in America. And really, there are two rivers that have to swim together. One is the scientific research and the development of therapies, cures, and approaches that we're discussing a lot today, and completely supportive of that. But the other side is, I don't know how to frame it, but really it's the reality that people are going to need care, caregivers who are full-time workers. We've seen this already through COVID, but, you know, an ongoing burden or responsibility, depending on how you want to frame it, is going to be part of this country more and more. Are we doing what we can for that side of the equation in addition to the scientific support side of this track?
Not enough. And, you know, women, and primarily women in families, end up being the caregivers. We've seen a huge number of Hispanic and Latino women being those who have to step up. Now, you mentioned the scientific side, and you know that's one side of this, but we're talking about families who have to care for patients with Alzheimer's, and in some situations, many people are unpaid. Now, One, we need to invest more in in-home care. There's a home-based community program that Build Back Better actually provides funding to help expand. That would help families provide care. Now, we also led on a letter, me and some members of the California delegation, to allow in-home care to have family members, qualifying family members, provide the care and actually be paid under this federal program. And so there's been some progress on that front, but we need more access to the program. We need resources for families who are providing the care, like training, what to expect. There is a bill out there called the Alzheimer's Caregiver Support Act, which would help provide some of that training and support services. But there's really a lot to unpack and a lot of uncertainty around Alzheimer's, in addition to making sure we do everything we can to have early diagnosis.
I don't know how to frame this right, but among your constituents, what is, when they find that they have a family member, as you did, as you found in your own family, suffering from Alzheimer's, what is their, I hate to call it literacy rate, but what is their awareness of resources, who to reach out to, how to find community? You know, for folks I know who have Alzheimer's among one of their loved family members, it is a beginning at the front end of a lonely and frustrating journey. And I know there are resources and networks out there, and we're interviewing some of them in today's program. And I'm very grateful they're all here. But I'd just be interested, as you talk in part to the Hispanic community, what is the level of connection and community there around Alzheimer's?
Well, I think that still a lot of education needs to happen, and people don't know what to expect. It still happens to me. I'll see something where my mother is declining more, and I ask myself, is this normal? Is this not normal? And I had to do research myself to find out the organizations that can help you, prepare yourself. And it's really hard to see a loved one like that. So we have to do a better job of telling people about the resources. I didn't even know about the federal in-home care program, the waiver program. It was not until a year and a half ago that I learned about it. And I was a member of Congress for years before that. So I think It's making sure people know about programs, people know what kind of books they could read to expect, making sure there's a support system, and that the training is there, but also the availability of caregivers, which we know right now, there's a huge shortage. I myself am a caregiver Sunday nights and Monday nights because I don't have a caregiver for those nights because of the shortage. So I think investing in people and the human infrastructure is so key.
Well, that was my next question to you, really is, I know you are one of your mom's caregivers, and how do you do it? I mean, you're a representative in Congress. I know that other people have jobs, full-time jobs, and manage this as well. But I mean, can you give us some insights as to how you juggle it?
It's a real challenge, especially because of the caregiver situation. I've been lucky in that we have proxy voting right now in Congress. So if I have to fly in on a red eye on a Monday so that I can do the Sunday coverage and then try to get help on Monday, sometimes I can't find that coverage. So I will have to stay home and care for my mom Sunday nights and Monday nights and then head to DC. And so it's a real concern. And as you mentioned, I'm one of many people this is happening to. And so we need resources and the ability to be able to provide care. And we know that population is growing of people who are going to be impacted by Alzheimer's. The other thing I want to mention quickly, something I recently learned about and didn't know, talking about education, is this tie-in connection of high blood sugar to Alzheimer's and dementia, something I was not aware of. And if you take a look at the Hispanic Latino community, we already have high diabetes rates. So I think there's a lot of areas where education needs to happen. And I'll be the first to admit, I'm still learning myself.
I think, one of the interesting things, if we use you as a benchmark for a member of Congress, I've also interviewed folks like, Diana DeGette, Representative DeGette, and Fred Upton, who are celebrated by many Republicans and Democrats for their Cures 2.0 Act and kind of trying to push, bipartisan work around investment in science for the kinds of maladies we're discussing today. And I know this is kind of asking for your gut feeling, but when it comes to what Congress is doing proactively and constructively, I just wonder, because I'm not aware, is it enough? Are we going in the right direction? Are we tilting the right way? What sort of scale do we need to achieve that we don't have? So when it comes to science, NIH, medical research partnerships, what's your gut feeling? Are we where where we should be, or do we need to seriously upscale those investments?
I think we need to upscale the investments. I mean, look, this is a public health crisis, and we're seeing the numbers, and the impact it's having on our healthcare system is going to be huge and costly, right? As a member of the House Energy and Commerce Committee and its Health Subcommittee, I'm committed to tackling this problem. Now, I am proud to say ENC recently held a hearing about establishing the Advanced Research Projects Agency for Health. So this new agency would be solely dedicated to accelerating the pace of scientific breakthroughs for diseases such as ALS and Alzheimer's and cancer. And the bill dedicates $3 billion annually to provide much needed research to discover a cure for Alzheimer's. But it's an investment in a cure, but it's also an investment in people, caregiving, and we need to prepare ourselves because this is only growing. And when we see promising drugs, we need to make sure they're accessible and we're not blocking their ability to make that progress.
Just finally, the President Biden recently resurrected and sort of pushed reset on his cancer moonshot efforts to expedite cancer research, to sort of de-silo a lot of the cancer research community and bring dissimilar parts of the research community together. Do we need something like a White House conference on Alzheimer's? Do we need the power of the president to bring together a lot of the research community, the advocates in that space, patients, caregivers, but I would also say, very importantly, the scientific community into a White House conference on Alzheimer's? I don't know if there's any chatter about that. This is just my own view that I sort of think I've been doing this for 20 years and I haven't seen one. So why not have one?
Right. Well, I'm with you. Why not have one? And I will wholeheartedly support it, and a good bug in the ear to put to the White House. The reality is that when you talk to folks is that there's a lot of health issues and it's hard to pick and choose. But one of the things that I was excited to see is that the House fiscal year 2022 appropriations bill included about $3.4 billion, which was an increase of $200 million above the 2021 level for Alzheimer's disease and related dementias research at NIH. So there's some progress, but we've got to tackle this in a huge way. And so I would welcome that level of heightened awareness and action. We need action, and people are desperate to find something to slow this down or to cure Alzheimer's and its impacts on our families and our loved ones.
Well, I'm sure our viewers and I very much value you're sharing your lived experience, but also what's going on in the policy space for this. Representative Nanette Barragán, Democrat from California. She is a member of the House Committee on Energy and Commerce and the Health Subcommittee there. She's also perhaps very relevant today, a member of the Congressional Task Force on Alzheimer's disease. Thank you so much for sharing your thoughts with us.
Thank you, Steve.
Wow, what a great conversation. Thanks again to Congresswoman Nanette Barragán for joining me. And I look forward to talking to her more about some of these ideas she mentioned. That brings us to the end of our program today. What a great day. Big thank you to Eli Lilly for its support and all of you attendees for hanging with us through these many conversations. I thought it was worth it. I hope you did it as well. Please share today's videos, which will be posted on our website shortly, with your friends, your family, people who care. This is important stuff, folks. I'm Steve Clemons. Be well.